A lot of people have, different back issues. And for those that have back issues, but spinal issues. Let's talk about spinal issues. Okay, so the thoracic cage, of course, our thoracic cage, that's, in our chest, contains the lungs and supports the muscles of respiration. Normal ventilatory mechanics depend on a compliant thoracic cage with free exertion throughout the respiratory cycle. What that means is that somebody with scoliosis, when they have a curvature of their spine, their diaphragm tends to push out a little bit. Their lungs tend to crunch a little bit, and it's a little harder to breathe. There is ways around it to still go through rehabilitation. I would just have to know that before I rehabilitate you, because I would have to tweak the therapy a little different. My therapy to do that would be work on the lungs independently. And what I mean by that is, lungs. You guys know how many lungs you got? So each lung is divided into 2 or 3 lobes, which are separated by 1 or more fissures. This right lung has upper, middle, and lower lobes. The left lung has only an upper and a lower lobe. Both lungs have an oblique fissure that begins on the interior chest at approximately the 6th rib at the mid-clavicular line. These fissures extend laterally and upward until they cross the 5th rib on the lateral chest in the mid-axillary line. Okay, so if I count ribs, here's my clavicles, go down. There's 1, 2. Now I just have to push in a little bit. It's easier to feel on the side of your ribs than here, because you got the chest muscle that kind of, you don't feel as much ribs, But yeah. When we work out muscles, we don't just work out the diaphragm. I find a lot of clinicians out there, a lot of respiratory therapists, tend to only work out diaphragmatic muscles and not the intercostal muscles also. And so I have patients that say, why is my breathing still the same when they went to a pulmonary rehab? So they get this idea that all pulmonary rehabs are like that. Not ours. Ours is very unique because we are very good at pulmonary rehab, because we work the whole thing out. We don't assume that, let's just work out the diaphragm only.
Hi everyone, Melanie here. Check out the HRN store by using the QR code on this video, or you can click the link in the description below. You'll find everything you need for rehab there. So take a look. At Home Rehab Network, we're dedicated to providing patients with access to cardiac and pulmonary rehab from the comfort of home.
We treat just about every pulmonary disease out there.
Our cardiac program is 3 times per week, where we exercise patients on a virtual platform together as a group, teaching patients about heart disease and how to prevent future heart problems.
We make the program efficient, but also fun and enjoyable.
With remote patient monitoring, we educate our patients first.
We get them to breathe better second. Patients don't come in and just get bored with the lectures. They work out with us. So that's what makes us very different.
I believe HRN's program is not just a program, it's an experience.